Hello and welcome to Early Bird by Amerisleep. I'm Dr. Devon Hoffman, and today we're going over tips to sleep better with low back pain. We've done the research so you don't have to lose sleep over it. Now, as we all know, it's incredibly hard to sleep with low back pain. It can be debilitating, it can cause countless issues, and it can basically lead to us being drowsy or even in more pain the next day. So today we're going to give you some manageable tips that you can use at home, a couple of different stretches, a couple different sleeping positions that can really help you get a better night's sleep. So the first thing we're going to be going over is the sleeping position and basically the different ways that we can modify our sleeping position to allow for less pain, less pressure on those painful joints, and allow for us to get a better sleep. So these first recommendations are from the Mayo Clinic, and basically here is what they have to say based on the research we have. The absolute best position is basically lying on your back with one single pillow below the head to promote proper alignment and not cause overpressure on certain joints. Now for low back pain specifically, I like people to add a couple pillows below the knees to basically put our pelvis in a posterior pelvic tilt, allowing the low back to not have so much pressure as we sleep throughout the night. Now the second recommended position is sleeping on your side with a pillow below the knee, and if you're sleeping more in the fetal position, having a pillow between the knee is also helpful to be able to basically promote hip alignment so that you don't get a pulling sensation on that hip and into the low back. And lastly, people that sleep on their stomach, this one is not recommended. However, if you can't sleep in any other position, try putting a pillow right below the hips, which will actually offload some of the arching lordosis pressure that happens in the low back. I've seen this one help a ton of patients in the past, and maybe it'll help you. Now, as we're talking more about pillows, it's important to have the correct pillow for your specific body as well as preferences. So check out Amerisleep's different options. Basically, we're looking primarily at thickness and firmness. Now, the thickness, depending on if you sleep on your back or your stomach, you're going to want a thinner pillow. However, if you sleep on your side, you're going to want it to fill the gap between your ear and the end of your shoulder, which is generally a thicker pillow. Now the firmness is kind of more preference based. Basically, you want a little bit of a firmer pillow generally to help support the body. However, some people prefer softer pillows and sleep better with those. So this part really up to preference, but make sure you try different ones to make sure that you're not just missing out on something that's better for you. Now, again, going into the firmness, we're going to be talking about mattresses a little bit. So it is a myth that a hard, rock-hard mattress is always better for your back. There is a good amount of research that shows you really want some good preference built into that, and some people do not sleep good on firm mattresses. So a medium firm mattress is generally recommended for low back pain and other back pain for sleeping because it provides enough support for our spine to be able to allow us to not provide too much pressure in certain areas. However, it also mixes with preference because we do want to be sleeping on something generally soft because it allows us to fall asleep and stay asleep a lot better. And lastly, how to get in and out of bed. We generally want to keep our spine relatively straight. So using a log roll method is one area that we use a lot in physical therapy, but it basically allows us to get up and out of bed in one big piece rather than twisting and turning, which can cause irritation to the low back. Now here are some tips that can help you manage low back pain outside of bed. The first one is going to be a little bit of movement. So getting some stretches for the low back, some core strengthening exercises, both of those can be fantastic. Doing simple exercises that target the low back and the core without causing any pain is really the sweet spot and can greatly help your low back pain. Now, another thing that can help is the mental side of low back pain. So research is showing more and more how the mental aspect of stress and issues and tightness throughout the body can cause tons of low back pain long term, just basically because of the inflammation that our body holds. So making sure to provide a relaxation routine before we go to bed can greatly help low back pain as well. Personally, I like to do a little gentle mobility session. 5 minutes is all it takes to help relax the nervous system as well as the muscles and sleep better. Now, 2 stretches that I like to do right before bed are child's pose and also pulling the knees up to the chest and rocking just a little bit. So both of those can help stretch out the low back and basically provide a little bit of motion to those vertebrae right before we go to sleep. Now, if your back pain does become more than, let's say, a 3 or a 4 out of 10 and stays around a long time, this is a good time to consult a doctor or a physician in your area to check out what's going on, see if you have an underlying issue that could be causing this low back pain and it's not just like a little tweak or a sprain. This is a good time to check these out. Go see your local physical therapist and give them some stretches, and they can do a full evaluation to make sure that you're doing the correct things one after another. So to recap, these are some strategies that we like to use with firmness, different pillow types, sleeping position, and also some stretches and exercises that can all basically help to relieve the issues that some people have, where they're either having pain when they're sleeping or right when they're waking up. Both are very common, and implementing these strategies can be crucial for basically developing a nighttime routine to get ready for bed and to stay asleep without having pain. And as a reminder, if your pain does persist, please make sure to go see a medical provider, as it can be a simple fix so you can get back to sleep easier. Thank you guys so much for tuning in to Early Bird by Amerisleep. If you did find this information helpful today, be sure to visit our blog for more helpful expert opinions and information on how to get the best sleep of your life. Until next time, sleep well and take care.